Martin, a cheerful 4-year-old, began feeling unwell with a persistent high fever lasting over 5 days. His father noticed additional symptoms: bloodshot eyes, cracked lips, a red strawberry tongue, swollen hands and feet, and a rash on his torso. Concerned, he rushed Martin to the pediatrician. Dr. Carter, the pediatrician, suspected Kawasaki disease, a form of vasculitis that inflames medium-sized blood vessels, particularly affecting the coronary arteries. To confirm the diagnosis and rule out other conditions, Dr. Carter ordered several tests. Lab technician, Ms. Thompson, joined Dr. Carter to explain the tests and their significance. "We'll be running a complete blood count, abbreviated as CBC, C-reactive protein, abbreviated as CRP, erythrocyte sedimentation rate, abbreviated as ESR, and liver function tests," Ms. Thompson said. "These will help us understand the level of inflammation and check for any organ involvement." Dr. Carter added, "We also need to perform a urinalysis to check for kidney involvement and rule out other infections. Additionally, an electrocardiogram, abbreviated as ECG, and echocardiogram will be done to assess his heart function and check for any coronary artery abnormalities, including the risk of aneurysms." An aneurysm is a bulging or ballooning in the wall of an artery caused by a weakened section, which can rupture and lead to life-threatening internal bleeding. Ms. Thompson explained that the blood tests would also include a platelet count, as Kawasaki disease often leads to thrombocytosis, which is a condition characterized by a high platelet count, in its later stages. "We'll also check his albumin levels and perform a lumbar puncture to rule out meningitis," she added. The results showed a high white blood cell count, anemia, elevated CRP and ESR, and low albumin levels. The urinalysis revealed sterile pyuria, another supportive finding. The ECG and echocardiogram showed no immediate heart abnormalities, including no signs of aneurysms, but close monitoring was advised. Dr. Carter explained to Martin's father that these findings confirmed the diagnosis of Kawasaki disease. He emphasized the importance of early treatment with intravenous immunoglobulin, abbreviated as IVIG, and aspirin to reduce inflammation and prevent coronary artery complications such as aneurysms. Ms. Thompson reassured him, "We'll continue to monitor his lab results closely during treatment to ensure the best possible outcome." After receiving IVIG, Martin's fever subsided, and his symptoms began to improve. Follow-up echocardiograms confirmed that his coronary arteries remained healthy without any signs of aneurysms. Dr. Carter scheduled regular checkups to monitor his recovery and ensure no long-term complications developed. Thanks to early diagnosis and treatment, Martin made a full recovery. His father was relieved and grateful for the care that helped Martin return to his happy, playful self.